My name is Dr. Lara Saleh. I've been a pediatric dentist for 15 years, and I've started Dr. Toothfairy Pediatric Dentistry 3.5 years ago. At Dr. Toothfairy, we want every dental visit to be super special for the parents and the children. From welcoming every kid with a sign at the door with their name on it, and then if they're nervous, they get to go to a special room that has no dental chairs to make them feel more comfortable. I became an Oryx customer 6 months before I opened my practice. I really liked that it was completely cloud-based and inclusive of all the extras that I would have had to purchase with other softwares. My first interaction with the parents is actually through Oryx. All the dental forms are sent to them, but it's really a way for me to get to know the whole family, how they function, what works best for them, and that guides me in how I would welcome their children the next day at the office. Most parents actually prefer booking online to calling in at the office and talking to someone. I get compliments all the time that they've booked at midnight and we were able to see them at 9 a.m. My team loves using Oryx. It makes their life easier and it doesn't limit them to being in front of the computer at the office. In the past, we used to have to go in and make lists of people and when to call them back for their appointments. And in Oryx, all of this is streamlined. It communicates with the patient, it reminds them. We can set it to however many months we want them to come back, 3, 6 months, 9 months, or a year if they choose. You can make notes directly on the chart. So I want to make a note on a particular tooth. I can just go click on that tooth and make a note, and I can make it a stagnant note or a disappearing note, which is great when you're seeing a lot of patients. You just look at the chart and you can get pretty much a comprehensive history of what's happened in the last 6 visits. I use the AI annotations in the x-rays that is built into Oryx. The annotation marks it with pink for a start of a cavity and red with the existence of a cavity. So parents are able to see it better. They see it color-coded according to the progression of the cavity. We send the referrals, all documents that we could give them in a paper form, we send it through Oryx. I made early on the decision to delegate as much as I can that is not in my scope of expertise. So one of the best decisions that I truly made for my practice is to use the Oryx RCM services to handle our claims and billing and collection. I have worked in about 12 different offices. My previous software is meant for general dentists, and pediatric dentists had to struggle to find kind of their part of it. With Oryx, I was proud to become one of the few pediatric dentists that got together and helped create the pediatric version of Oryx. And Oryx was great about incorporating everything on one page, kind of like the hero page for us has treatment planning, finding, everything in one page, and that has helped tremendously. As Dr. Toothfairy is growing, Oryx is also growing and adding more features, which really helps in growing the practice. Oryx by dentists for dentistry.